Hi, Brenda.
Hello.
Here I am. I'm calling you from Surrey in Newton. Where are you right now?
I'm actually in Burnaby, and you're
Oh,
seeing out here is the Burnaby General Hospital, just right behind the new clinic here.
oh, wow. So your new clinic, it's called the Changepain Clinic, right?
It is, yeah. It's
Yeah.
actually Changepain Medical and Allied Health now, just because we really wanted to show that integration, and it's sometimes not that obvious, but it's both. It's all under one roof now.
Okay, Changepain Medical and Allied Health. Yeah. And that's located just close to the Burnaby Hospital there.
Yeah, it's about a half a block away on Gilmore Way, 350. The address is on our website.
Okay, it's on Gilmore Way. And what are some of the services that you have there at the clinic? It's only been open a couple weeks now, right?
Yeah, except that we've already been 10 years old. So pretty much what we've been offering for 10 years is the same and more now. The space is a lot bigger, so we can do a few things from a medical side of things. The pain specialists have always had this kind of graded layer of care. Many people might just need like a few trigger point injections or certain nerves to be kind of anesthetized to kind of break the pain cycle. But when that kind of doesn't work, the pain specialists go on to ultrasound guided type of work. Like, for example, if I were to just show you like a machine like this, we have some very specific purpose built rooms for that. And if that doesn't work, we even have our own X-ray fluoro room that goes into deep spine joints, ligaments, use of contrast, nerve root blocks, you name it. That's the medical side. The actual other side is also infusion therapy, which is very specialized with lidocaine and ketamine. The allied health team in our earth wing, because all of this is in the ocean and the forest wing, the earth wing is all about the gym. It's about strength, groundedness, chiro, kinese, physio, acupuncture, somatic therapy, yoga, there's counseling. So the whole breadth of that allied health team is there too.
Wow. So you got like all sorts of interventional therapies and the operating room facilities and the technology and equipment to do that. But you also have a lot of the mind, body, spirit connection services, including the all the manual therapies
Yeah,
um, and kinesiology, kind of the strengthening, the patient empowerment parts
yeah,
of pain management.
yeah,
Wow, you really have
yeah.
everything there. And it sounds
Well,
like you got a whole ton of allied health there.
yeah, we do. We have a 70-person team, and about one third is allied health and one third are medical doctors at GPs and specialists alike. But kind of in addition to all of that on-site stuff, we actually have a whole breadth of, like you said, the wellness, prevention, the pain management online. So I think that really is that other layer of complement of services, especially when really not everyone can access us at in the Lower Mainland or in Burnaby.
And I think you mentioned there are actually quite a few family doctors who work with you as well. Is that right?
There's right now three, four right now, and then a kind of a cadre of our fellows who are part of our UBC fellowship, who are also a family medicine background.
Oh, wow. So there's a family medicine fellowship in pain. Is that right?
There is, and a
Wow.
specialist one. So we can train up to about six of these advanced trainees per year.
Wow. I really like how you've named parts of your new facility. You've named them like, did you say like earth and ocean and stuff like that? Is that what you call them?
So we have an ocean wing, we have a
Uh-huh.
forest wing, the earth wing, and the light wing. So there are four elements, and it's on purpose actually, not only as you can see. For example, I'm in the ocean room, one of the
Mm.
ocean wings. So it was purposely from a color perspective, but we also know from an environmental perspective, the color tone can make such a difference with healing. And blue for grounding, but green for our widespread pain patients, as an example. And
Mm.
nature is the best healer, both inside and out. So we thought we'd
Oh,
honor
that's beautiful. I got chills when you said that.
that.
What are some of the referral paths? How do people find themselves to you? Is it Mostly just family doctors referring, or who else?
Well, so as you know, we have a whole host of all our MSP services. So any doctor, nurse practitioner, and family physician specialists have an MSP number and have a route that way. So just the standard referral in. They fax it in as per usual, but we also have email versions if people like to. Some people actually like the really direct diagnostic stuff. So for example, you just want to know if that joint is making the problem. So we have a direct route just for that. You don't necessarily need to have a 20-person team or all the interdisciplinary stuff. But the others are through ICBC, WorkSafe BC. So just like it is with any other physio or chiro clinic, either people can walk off the street and show up for the appointment. They can book online through our website. They give us a call. And so those ones are just self-scheduled and third-party supported, direct paying.
For some of those services where you said it's kind of like just a specific diagnostic um, thing that I like, if I just want to know, is the pain from this particular joint? How do I, as a family doc, refer for something like that?
Perfect. Literally just either two ways. One, you could just fax it as per usual and just say, I really just want to have this diagnostic right here at this level. Or it's like, in fact, like a radiology requisition, like what you would do to send in for any of the hospital services. No different. You can just put that on a referral note. We do prefer that you use our referral form because it does give more information and can be integrated in your EMRs. Or the second way, literally just send us your consult through the email called procedures@changepain.ca. We will take that just like a new referral, and but some people find it just so much easier to do it. So it doesn't matter either way for us.
So we could just email at procedures@changepain.ca.
That's correct. Yeah.
And I'm sure your referral forms are on your website, and they're probably also on Pathways BC, probably on there too. Yeah. Okay.
That's right. They've been upgraded, and just watch out. We have a new website coming out in the next 3 weeks. It makes a lot of things even more easier to navigate.
Okay, so right now it's near the end of January in 2024. So like mid-February, you guys are going to have a website upgrade. Okay.
Yeah, that's right.
What are the kind of the wait times that we're looking at for the different services that you have there?
Well, the wait times will fluctuate. We will always take people on an expedited basis. So if anyone who's in really high neuropathic crisis, maybe a hot disc herniation, CRPS, for example, in fact, just text us even directly. I have no problems alerting us that way. The phone calls kind of go through a bit of a queue. So we do have a line that's doctor specific that again should be received a lot faster. But summary is that the average, even non-urgent, can be seen within about 4 weeks for MSP. We have, and again, that does fluctuate, of course, depending on if the doctors are vacation and just times off that way. But outside of that, we've just made a lot of automations in the system to ensure a little bit faster entry route. The Allied Health is direct online scheduling, and usually it's less than a week, and even same day at some times. So we really tried to make that a really accessible service.
I'm sure that a lot of the allied health, if you have third-party coverage, then that would cover some of the services. What about the kind of the interventional procedures? Is that all covered through MSP?
Most interventional procedures that basically are covered by MSP items, yes. We do advanced procedures that MSP has not, brought into their items for. For example, prolotherapy, regenerative therapy with platelet-rich plasma, infusion therapy with lidocaine and ketamine-assisted psychotherapy. These and just cryoablations is something that's covered, for example, but they'll have like an upgrade fee because the MSP doesn't cover for what happens in the community for the specialized equipment, unlike what's already in the hospitals. So there's those small things, but generally anything that's MSP covered is just MSP covered. There is no additional fees except for any upgrades for very advanced equipment like the X-ray.
Oh wow. Okay. So most of the therapies will be quite accessible to all the folks. You mentioned some advanced therapies that actually I wasn't even aware that were provided. One of them that stuck out to me that you just mentioned was prolotherapy. Is that where they inject kind of like dextrose into parts of the body?
So it really depends on the inject date, but there's many different ways of creating a substance that's a bit more targeted inflammation. And it's true, you want to target inflammation in ligaments that are showing some laxity. Very common presentations is like whiplash associated disorder after MVA that's not responding to physio, not responding to, let's say, muscle releases, all types of medications. You wonder about a laxity component when they can't even hold up their head very well. So it's those kinds of things that we pick out for prolotherapy.
Oh, for laxity. Laxity. Okay.
Mhm.
You also mentioned, well, what did I catch? Something like ketamine infusions. Did you say ketamine assisted psychotherapy? Is that's available at your site?
So there are two different things there. We know ketamine on its own is an anesthetic, but when you're using in very controlled doses, either IV or oral, they are good for depression that's refractory to a lot of different other therapies, medications, ECT. Ketamine on its own is very good for very specific pain syndromes like migraine status, the neuropathic pain syndrome, CRPS, some of our widespread pain syndromes, some post-surgical pain syndromes as well. So it's a variety. And of course, about 70% of our patients overlap with mental health, mood disorder, and pain. So it's kind of a twosome at that point. If all the other ones don't seem to make any inroads, or someone is really severely flared up, we really need to do a reset that's faster. Yeah.
Wow, that sounds really kind of leading edge in terms of therapy because I've definitely heard of using ketamine in psychotherapy, but it's really neat and it makes so much sense to me that because we see in primary care as a family doctor, we see so much overlap between chronic
Yeah.
mental health challenges and chronic pain.
Yeah.
So it sounds like your team has really identified some leverage points of leverage there.
Lawrence, this is such a huge thing, especially now. So many things are impacting people's health from a mental perspective. And we don't just use these like therapies only. We think of therapeutic yoga. We think of the group medical visits with pain neuroscience. That's MSP all covered. We think about movement therapies, eating differently, even increased protein for depression management. There's a whole variety of things we have to look. How do we change neurochemistry that presents itself like depression, PTSD, anxiety?
Wow. I don't know if I told you, but when your clinic was located in Vancouver, I actually was a patient there for I had some chronic pain from arthritis, and I met with one of the nutritionists there, and they really helped me kind of switch things around for my psoriatic arthritis. So really cool.
It makes such a difference. You know, I always think of our bodies as like a plant in a pot of soil, and the soil is nerve system, gut system, the immune system. And you're right, sometimes just a little molecule change with what we do makes all the difference.
Now that location in Vancouver is no longer existing.
No, we are
No.
only located in Burnaby now.
Okay. What do you think is going to be the most popular service at your site? What are the things that you think that you're going to get like a lot of requests for?
Well, in our last 10 years, we've always just known from an MSP perspective, of course, that's most popular because it's accessible. But what's popular is not necessarily what is appropriate. And so in our minds, it's always been a layered care. So whether it's only MSP, you still get access to our whole interdisciplinary care team because that is online groups in addition to what the doctors can do on site. But outside of that, if you want individual work, if you can layer on, let's say, third party pay or yourself, your own out of pocket, this combination direction of doing everything together. When people share their notes, they can share how they do the progress and help the other team member. It just makes all the difference because you're not fragmented, you know, in different isolated, clinics. And we always like to collaborate with our other healthcare clinicians, like the allied health that's in the community. just because we do all the services here, we really want to be able to graduate people onto their community kind of teams, because it's all about that collaboration. So I think from a popularity perspective, well, I'd say low back, neck, shoulder, headache, post-surgical are some of the themes of popularity, if you want to call it. And then second to that would be things like abdominal, visceral, widespread, gut, and pelvis. Those are, if you will, the more common presentations that we see.
Wow. I remember you speaking at the St. Paul's Family Medicine Conference, and I learned then that you were an anesthetist with an interest in pain. What kinds of training have you gone through that have really impacted your view of pain services, pain management?
Wow. I was so inspired by my own anesthesia residency, because it's the only residency, the primary residency, that introduces chronic pain as a rotation. It was dedicated a couple of months, and it was since then it inspired me to go on to 3 years of training in Sydney, where my professor at the time, Michael Cousins, he was forging pain medicine as faculties, pain medicine as examination, pain medicine as a residency specialty. And so now in Canada, we've created our own, of course. It's a 2-year post-grad one. But then I went on to become a certified hypnotherapist as well. And of course, all the ultrasound detailed work. So I think that combination of having the acute pain expertise, regional with anesthesia, the chronic pain under pain medicine as a specialty on its own, adding on that hypnotherapy aspect, which is subconscious, the noetic causes of pain, mental health, and overall body dysfunction. And then, of course, just the skills training in ultrasound and x-ray. It's that whole combination that helps you see this different level. But I can't tell you what really changes my mind is having these rounds with this team. They see it from all these different angles, and doing it 2 to 4 times a month as a team is incredible. Everyone has a big worth in their perspective on how pain can be changed.
Yeah, what's standing out really clear to me is that you have an amazing team. You mentioned over 70 different team members potentially. And yeah, I don't know any other interdisciplinary team that's really like co-located like yours, works together in one clinical area. How did this come about? How did you manage to corral all these folks together?
I think if you stand with a passion, there are many, many others out there who feel the same way, that no symptom is an island. It's actually all connected, and really so should your team. And so I think what it is that just over time, like I said, we're 10 years old now, and it's been over time a collective of brilliant people, brilliant minds. They've come and gone, and others have stayed. And we hope to, in fact, inspire many of our colleagues out there to do the same. I don't think everyone needs to have a 70-person team. There's no doubt it's not easy to do that. We've been really grateful to really meet some amazing experts that are internationally recognized and just will continue to do their art. But we really hope that the system itself will start, as we've seen, primary care homes, many other initiatives that are starting to show itself to really look at addressing whole person care. So I think for myself, it's just gratitude, for others who are willing, capable, and eager to actually make that difference. And we've just become a beacon for that. Yeah, so just really grateful.
That's inspiring, Brenda. Anything else you'd like to add before? Hopefully, you can take us on a tour and maybe show us some of your team members today.
I can. In fact, I can just start walking right now while we do it.
Sure.
But what I will add is you can see here, this is an ocean room. And all 3 of them are just like that. We're entering into the corridor. In fact, I'll just take a really quick peek into the general reception area.
Oh, yeah.
And so in this area, we actually make this into quite a calm and serene, even though there's a number of aspects. And there's one of our pain fellows, this is Dr. Naveed Mahamad. And we're just all getting ready to enter into the forest wing.
The green, wing, yeah.
That's right. You can hear the bit of the serene music in the background. We have a peek into the x-ray room. There's some patients in there right now. So I just wanted to show you a little bit of a sneak peek there. But here's one of our nurses, Akbar, who's actually just overseeing our infusion patient right now. And it's a bit of a quiet zone, as you can imagine, because really our goal is to demonstrate, and one of our nurses, one of our pain fellows this year. There's some of the dedicated rooms here in terms of just separating clean and housekeeping kind of areas. This is our light wing now. So light wing is where
natural light.
it is natural light, the salt light, the nourishment bars. Another one of our fellows, Dr. Art Schiller. And we're going to enter in finally into the earth wing. So the earth wing takes on a number of dedicated kind of meeting rooms. There's also our physio rooms like so. Our allied health team, in fact, we've got a couple right now. It's our Director of Integrated Services, Dr. Lindsay Wright, and Leroy, amazing people with physio kinesiology background. And they work in this space here, which is essentially the gym area of a lot of different types of equipment like Pilates or otherwise. And then we actually have a second reception, which enters in through here. So we are now able to separate kind of both sides of the services and allow for not only separation, but yet at the same time integration, as you've seen us kind of walking through in this section. Yeah, so that's a bit of a summary of our services and space.
It's amazing. Like the design is fantastic. The flow through all the different sections was really easy and really quick. And I can see how easy it could be for your team members to share information and share ideas.
I think actually that's a really good point. The space harmony is really important. As you notice, I'm about to enter back into the light wing. By doing this, this allows both the medical and the allied to actually hover. We actually created this space very purposely. These desks intermix. They are actually meant to allow for creativity, nourishment. We have people who might need specific quiet rooms. And so even though there's open collaboration, places in which something like this offers creativity, we actually wanted to also have quiet flow of the brain. So we're just trying to live what we are exposing out there as well.
It's so cool. I love the integration of nature into your design as well. It's very healing. I love it. Thank you so much, Dr. Brenda Lau, for taking us on that tour today. Anything else you'd like to add before we stop today?
Lawrence, I'm so grateful that we could share what we've been doing now for 10 years. We're hoping to inspire others who can really start to see early care, full care, teams where we can to integrate is going to be the best. And you know what? We're just here to help. So if you have any questions, just don't hesitate, and you're welcome to pass out my details to our colleagues, and then we go from there. I think if we could really get at things earlier, we won't see the cascade of opioid crisis. We won't see the cascade of MAID and or street drugs, illicit use, or mental health that's so refractory to care. So I just letting you know, we're here to help.
Thank you. And your website again is changepain.ca. Is that correct?
Yeah, that's right. Yeah.
Okay.
And the new one will be very, very different.
Okay. In mid-February. Thank you again. Thank you, Brenda.
Thank you so much.